immunotherapy and clinical cases, case presentation. I will be discussing a treatment that is based on double-blind studies and evidence from basic science studies and from the results of environmental medicine experts who've been using these treatment modalities for 30 years now or more. And we have such experts present with us, Dr. Rea, Dr. Monroe, and I'll be describing the immunotherapy. I present a significant number of patients with environmental diseases, and 80% of patients with MCS have food sensitivity or problems with biological substances that are inhaled. Lee in 1961 started using this technique. This was modified by Miller, and in 1972, the provocation test and neutralization therapy, the Lee modified approach was described. For immunotherapy, the challenge tests are very important. This has to do with different concentration levels of substance injected at different levels of the skin in multiples of 5 in regard to degree of dilution. This provocation or challenge neutralization test aims at 1. Diagnosing. We shall be able to detect sensitivity to food and other chemical substances, and also to determine the neutralization point for each substance that has been tested. On the other hand, this also will allow us to institute treatment, low-dose immunotherapy, preparation of vaccines, individualized vaccines that include the different tested substances. The aim of this approach is to neutralize all of the possible effects of the provoked reactions produced by the substances and the chemicals that were used for the challenge test. We will observe a local reaction. We have a papillary wheel formation and one which is delayed reaction, which will be a reproduction of symptoms and signs. A test that has a minor intensity most of the time. This allows us to detect more precisely the minimum dilution levels, the minimal dose that will allow us to keep the wheel inactive, and also that will allow us the levels that will allow us to neutralize the symptoms and signs. This is going to be described later on in detail how this technique is used, how it's performed. Thus, for diagnosis, we'll be able to determine the final dose, which will allow us to eliminate, control symptoms and signs without adverse side effects. The duration of this process will depend on the degree of severity of the condition. In some cases, we may not detect, we may not see any reaction because of the reaction burden, which is very high for the patient, and the dose we use is too low. we'll be able to determine precisely and safely the treatment that will be used. Sometimes we may have a sudden rise of the toxic burden that may be due to interrecurrent exposure during testing, or perhaps following treatment such as sauna, hyperthermia treatment, we will mobilize internal toxic agents leading to adverse reactions that will complicate patient status. It is important to stop the test, give vitamin C, allow for recovery after administration of high dose of IV vitamin C for patients' recovery, and thereafter to continue the process. So if we see these adverse reactions, these are the steps to be taken. However, in some cases also, each time we give this agent, we activate symptoms and signs, and sometimes it may be too slow, and sometimes we are unable to get a reaction. And this is because of the fact that the patient has excessive toxic burden, and this should lead us to reconsider and to make sure that external toxic agents are all included, and we have to exclude external toxic agents. And we have to in this way we have to reduce toxic burden, and we'll have the possibility of neutralizing symptoms and inactivating the wheel that is produced. Treatment includes preparation of vaccines. We can include up to 25 in regard to food allergies. We can give active substance plus saline, free of preservative agents. This should be sterilized and frozen. It is necessary to use a certain dilution dose. The frequency of administration will be based on the severity of the disease process. One vaccine a day is what is more commonly used. But if there is exacerbation of the symptoms, then we can give another extra dose. All experts have seen that neutralization is much more effective in the presence of vitamin C. Patient training, patient education, patients who are here know that when the symptoms present, they should have the injection immediately before it becomes more intense. The duration of immunotherapy treatment also will depend on the initial condition of the patient, initial patient status. Usually it is from 6 to 18 months. There are more severe cases where the duration can be as long as 2 to 11 years. Sometimes patients will require hospitalization. And as I said, there are some cases also that require treatment for the rest of the patient's lives. So we do retesting at 3 months, a challenge test at 3 months to be able to adapt and adjust dose if necessary. Whether it's necessary, we can determine whether it's necessary to change the dose to determine if we can get better neutralization point. And if the patient shows improvement or exacerbation of symptoms, then we should also do testing, and that is usually done at 4 months. So we use a specific antigen that's injected into the skin, and baseline data is recorded. We are going to have electromagnetic bioelectric transmission. It is probably mediated by endorphins. And you get this interaction, and you have induction of homeostasis and regulation. This is the baseline regulation system. And this is the functional aspect of the extracellular matrix. I think we might have forgotten about that. I would just like to review this very quickly. It's a functional unit comprised of peripheral vessels, conjunctive tissue, cells, extracellular substance, proteoglycans, nerve endings, autonomic nerve, and somatic endings. This accounts for 10% of the total body mass. It is the biggest organ of the body and its main protective organ. Its main field of action is regulation of the different processes of the body, area of transmission of substances between the bloodstream and cells. Composition, I'll go very quickly through this just to review function a little. We have protein fibers, collagen, reticular type, elastic ones. They provide support and also permit communication. And this is seen all over the body. And we also have the proteoglycans, which is an important and necessary part also. It acts as a filter, as a reservoir for cations and for water storage, and also for information transmission. Then we have the iron fibers, they're glycoprotein. They're fibers that connect the cells and the extracellular matrix. The interstitial fluid comprised of water. This contains amino acids, sugars, coenzymes, neurotransmitters, hormones, cytokines, and these are messenger substances, minerals and salts and products that are discarded. So we have the cells. The cells are responsible for synthesis. Briefly, let's have a look at the proteoglycans. This is the structure comprised of disaccharide parts, and you have the matrisomes. These are linked together, comprising this network, which is very important for the extracellular matrix. It is a very highly negative charge. This attracts sodium and potassium chiefly. This structure is fundamental. This is responsible for hydration of the extracellular matrix, for filtering and for storage of the information and for transmission of information. So that has this very important function. You see this very three-dimensional network. Particle size can be seen here, and you have this arrangement involved in all of these extracellular matrix structures. You have the Golgi system, and this the half-life is 2 to 22 days. Apart from providing support, it permits communication also. This is very important. for the body. It is based on a system of microcables. Through this some small microfiber connections, it links the extracellular matrix with the part inside the cell and the nucleus, setting up this network together with. Yes, well, I'm having trouble also. It's not only Dr. Ray who has problems with the computers. I think I lost track of my slides, too. Let's see. I was saying, this is important for transmission of all of the electrical activity. All the bioelectrical information, apart from the chemical information, is the language that links all of the cells of the body. When we administer the dose, this will bind to the proteoglycans together with water molecules. They produce these glycocalyx and pass through the cytoskeletal structures, get inside the cells, and continue this process. When there is extracellular matrix change, we have alteration of its functions. If there is some toxic chronic stimulation, there's chronic alteration of the extracellular matrix, and there's loss of function, etc. So, if you have different pathological conditions and different functions involved, this injection will achieve ionic flow, achieve a balance between fibroblasts and macrophages. It will store this information in the cells, and this will also allow a electromagnetic frequency that can be stored and can be activated with each administration. There is reinforcement of the homeostatic function. Why do symptoms disappear? Not all not everything has been elucidated. It may be due to inhibition of leukocyte activity, change in proteoglycans, but that has not been fully elucidated. However, all of the experts agree that immunotherapy is effective for prophylactic treatment of different types of antigens that may be taken per os, inhaled, or through contact when that is administered appropriately, regularly, or before exposure. It has immediate effects. It increases the efficacy of the utilization time and frequently leads to reestablishment of tolerance. The utilization dose is specific for each antigen and also for each patient. It is inversely proportional to the degree of sensitivity, and it changes when there are changes in the clinical status of patients, and necessary to use it more frequently in patients that have higher sensitivity. Improvement is achieved only with the appropriate dilution. Others may exacerbate symptoms and signs. Improvement is very rapid, frequently at 10 minutes following administration. It is effective via the intradermal route, subcutaneous or sublingual route. Patients that are highly sensitive with high toxic burden or high deficiency of nutrients, it's impossible to find a neutralization dose and may be necessary to reduce the toxic burden before treatment. Thank you.
Gracias, Elisa.
Álvaro viene ahora.
Sí.
Y ahora va a hablar Álvaro Raboso.
Following our program, we have the next speaker. a member of our nursing staff, and will be describing this technique and describe a case.
Sí, vale. Pues yo voy a explicar un poquito la técnica que hacemos en la...
I'll describe the technique that we use. I'm sure some of you already know about this technique. We use this, it's an intradermal injection. In some cases we give it via, we use the a sublingual route. The end point, as Elisa said, is the point when the patient does not react to the substance, when that is given via the intradermal route, and when we give that sublingually, the end point is achieved and the patient does not show symptoms and signs. As Elisa said, the higher the dilution, the more sensitive it is to the allergen. So we start reducing the dilution level, and we dilute the substance until the patient no longer reacts. Different testing techniques. I said we determine the neutralization endpoint. We give intradermal inoculation of 0.01 or 0.05 of each antigen. We assess the wheal every 10 minutes or bleb every 10 minutes. We assess the wheal every 10 minutes. And after the first injection, it's here, up here, you can see that's a bigger reaction. It's a positive reaction. You can see we compare that with the physiological serum saline dose. And we inject once again, we inject once again, and we inject once again until we get the minimum dose, the neutralization point. That is the neutralization point for that patient's vaccine. We're not very good photographers, so I think that is really very bad pictures. You can see it is red, indurated, erythematous, and you can see how that wheal size is being reduced. And it's also important to emphasize that the patient should not have these reactions. Patients may have hypotension, they may feel dizzy, so those symptoms should disappear before we give the next injection. Sublingual test that's indicated for children, particularly those that are afraid of injections. And before starting the injection, we take the patient's pulse. 65, for instance, that's noted down. We give the sublingual dose, and we follow the pulse to see the pulse changes. And, we should observe changes in pupils, changes in color, facial skin, hyperactivity, rhinitis, see if there is aggressiveness, or the child shows some sleepiness. So changes in face color.
Cada vacuna contiene 25 sustancias. Este es un ejemplo, no se ve muy bien tampoco.
And here you have fungus. You see, we put all of this, we prepare the vaccine according to each patient, that is kept under the right temperatures. When we give this by the sublingual dose, really, that increases costs because that will have to be taken 3 times a day. Whereas with intradermal injection, we give 1 injection every 24 hours. But for the sublingual route of administration, that has to be given 3 times a day. So Retesting, that's done quicker than normal testing. We use 4 substances each time. We eliminate 3 substances at each test, and we try to include all of the substances in the patient's main diet. And the third testing would include chemical substance. In some patients, we do not include the chemical substance until after some time has elapsed. I'll describe a clinical case, a 9-year-old girl who consulted about a year, 9 months ago. The patient was assessed by the doctor. The patient showed deficit of attention, psychomotor deficit. The patient had loss of balance, difficulty in gait, headaches, and GI disorders. 3 vaccines were prepared, and we got information. A patient did not tolerate treatment with vitamins and minerals. That was not well tolerated by the patient. So we gave 3 vaccines. Initially, we used the sublingual route of administration. Then we switched to the intradermal route. The sublingual approach is less precise. It depends more or less on the physician's eye. It depends more. It's not as precise as the injections. We gave information about the chemical substances. After a year, the patient also was kept away from school and had a tutor at home for a year. Intradermal testing, you see this local reaction wheels, and you can see reddening here of the bleb or the wheel. And we had to switch to the other arm, and very often we had to discontinue testing. With sublingual administration, the patient was irritable, had anxiety, and was very aggressive. I had experienced some of these aggressive reactions of patients. We wanted to determine, well, you cannot see this very well here in this slide, but we did a drawing prior to the intradermal injection during the testing period. And initially, the patient was aggressive. Initially, let's see if you can see it better here. We did also this testing. We asked the patient to draw during this period of testing. You see, when the patient was inoculated, you can see her irritability, the marked lines here. You can see the changes. As we proceeded with testing, with time, you can see how the patient's reaction changed. You can see that there's small change in slight changes in drawings. You see the birds here, more or less better drawing. And when we reach the neutralization point, you can see this 8-year-old girl, she's 9 years now, and this was the result of her drawing. So this was also another way of assessing her changes produced by the injections. So this is what we had. There are only 6 birds in this drawing and very clean lines here. Now, if we compare that with the initial drawing in the same person, we can understand very easily why there are difficulties at school, because we were dealing with a fungus here, but for chemical substances, some of the children, irritability and anxiety might be produced by the reaction and sensitivity to that chemical. So this is the results. The patient had a year, 9 months of treatment, passed all her exams, all her school subjects. There was total recovery, psychomotor recovery, and balance. Before she received treatment, she could not walk. She lost her balance. Now she can ride her bicycle. She has no headaches now, and occasional GI pains. Now she's able to tolerate some type of food supplementation. So, thank you very much.
Una cosa.
Pasas a decir, cuando termine ella, se va a pasar primero ella y luego pasas tú.
Vale.
Y te quedas con ella, pues.
Te paso el juguetito.
Solamente nos queda
So now we will have some provisional data. They're not significant. They have no significance, but they're just preliminary data. And we just want to share the initial data with you. We shall continue research work, continue collecting data, and we shall be presenting this in subsequent meetings. Patients in our foundation that have undergone immunotherapy. Mean age, as you can see here, age ranges from 30 to 65 years. This is the representation according to age and sex. Mean age, 44 years. You can see that with immunotherapy, there has been improvement. Mild improvement in 17 patients, moderate improvement in 22, and significant improvement in 7. No changes in 8 patients. Let me mention once again, these are just approximate data. So we have to have a bigger series and with a longer follow-up to be more precise and to get significance. 2 patients that did not improve, they had no follow-up after immunotherapy that was less than 3 months. 2 patients, less than 3 months of immunotherapy. 2 patients, less than 6 months of immunotherapy. And as I said before, the duration of treatment changed. And it depended on the severity of the patient. There was 1 patient, the patient did not avoid all of the toxic substances completely, and 1 patient did not respond, and so we cannot ascribe the patients abandoning poor results to anything. So let's see, we have a patient here. Desiree is our patient. Hello, I'm Desiree Lopez Gonzalez. I'm 15 years old and I have MCS. My condition started in 2008. I thought that this was the worst time of my life. In summer of 2008, I had throat pains. Thereafter, I started losing weight faster and faster. My parents took me to a psychiatrist, and after waiting for 1 week, while we were waiting for the results of the analysis, I lost another kilogram of weight. So we had a lot of tests. I did a lot of tests on me at the Puerto Hierro Hospital. I was admitted to hospital for 3 weeks. I had really a terrible time during my hospital stay. I was diagnosed as having anorexia, and because of my appearance, that I studied well, and that I did ballet. So they thought I was anorexic, and they didn't even allow me to leave my room. After undergoing this psychological torture, my parents finally asked the doctors to discharge me from hospital voluntarily. And really, we had these very terrible, torturous days, terrible memories. So we need we needed to look for a doctor because I did not improve, and according to the tests that were done on me, that was psychiatric or psychological disorders that I had, or it was ascribable to anorexia. So after eliminating or identifying the toxic substances, I slightly improved. I went to GI experts, digestive experts. I had a lot of drugs and treatments that were always I did not like at all, and we had some of the food caused this type of stomach problems, gut problems, and reducing reducing the food intake and switching to biological food stuff that had no preservatives. I thought that we could begin improving. So we started using this approach, and my skin color changed. I was not so white and longer, so pale, and I started to. In October of 2010, at the Alborada Foundation, I was diagnosed as having multiple chemical sensitivity, MCS. Thereafter, my improvement has been spectacular. I have gained 8 kilograms. I have less complications, and once in a while, I have some of these problems. Dr. Pilar Muñoz Calero, if she had not treated me adequately, I wouldn't have improved. I'm really hurt that there are people who treat children with their age at a time in this period of time in their lives when they're supposed to be happy cannot be diagnosed correctly. This environmental intoxication and pollution that human beings have caused make these children very unhappy. This at age 14, at age 15, we will never recover that period of our lives when pain destroys you psychologically and physically. Just dressing requires a lot of effort. And at the same time, I see people so close yet so far away. So I would like to emphasize that we should be intelligent to be able to react, to take measures, institute measures, and to correct mistakes, to have a better world. Life has to do with people and not with words or diagnoses that are just written down on paper. We should let people, the future generation, have a nice place to live in. We should correct our mistakes. We should treat life as a treasure. We should treasure life. Otherwise, we will not be able to live properly. Desiree.
Bueno, y a la salida.
Outside, we have forms that you can fill out and put your signature on so that we can collate all of this information.